Can everyone hear?
I didn't want to use this thing. Okay, so I'm going to tell you about the Supporting Health Dementia programme, and in particular the new focus of our work, which is around dementia-friendly communities. So the programme is something that we're extremely proud of, not least because what we've already done is to demonstrate improved health and well-being for people with dementia and also carers by introducing very simple but valuable health improvement messages and lifestyle changes. And rather than actually doing the do and carrying out a caseload, so to speak, what we've been able to do is to support, motivate local services, organisations in the north of the city, so that they really do understand the unique physical health needs of people with dementia. And this is something that we feel that has never really been done before, where there's a focus around physical health. Okay, so as we know, dementia currently affects over 800,000 people in the UK, and this figure is projected to rise to 1.4 million by 2038. But dementia is not just a disease of the brain, but it affects the holistic health and well-being of the person with dementia and also the family carer. So with this in mind, the primary aim of the programme was to ensure that people with dementia and their carers were included in all aspects of public health right across the city of Manchester. So the first phase of the programme involved adopting a dual approach. So firstly, a programme of physical health checks. So Pam Kehoe, who's our specialist dementia nurse, would work with individuals over a period of time and pick up on any kind of physical health problems. And I suppose her role was very much about signposting to other health improvement services. And secondly, to increase access to health improvement opportunities. We particularly focused on those that were reluctant to engage or hadn't engaged with existing services. So, for example, we targeted those that had been newly diagnosed, the homeless, people with dementia who had Korsakoffs, alcohol-related dementia, and those living on their own. And we particularly picked carers as a group of their own. And as family carers, because they provide that backbone to care provision in the UK, we felt that it was really important that their care and their health and well-being wasn't overlooked. So what we found from that first phase of the programme was that opportunities to maintain good health and well-being are dependent on everyday things, so things that we may all take for granted. So, for example, having that control over life, having friends and family, community groups around us, and also access to services and facilities in the community. And these can be made quite difficult if there is that real lack of understanding within our communities. Furthermore, what we found was that a lot of community voluntary organisations and also public sector services and organisations, they were already in contact with people with dementia and their carers without realising it, that there was just that need to raise that awareness and understanding of dementia. I've got a note here as well that says that, it's also worth noting the negative impact that loneliness and isolation can have on that mental and physical health, estimating the increased risk of Alzheimer's disease by 50%. So again, all this just reinforced the need to take this approach. And of course, this was set out in the Prime Minister's Challenge in Dementia that was published in March 2012, and he built on the National Dementia Strategy in 2009. The notion also links in well with a lot of the national and international work to develop age-friendly cities, where Manchester's valuing older people are a key lead. I know there's a lot of work that's been done in York, the Without Walls project, the Joseph Rowntree Foundation, some excellent work going on around dementia and community-friendly, dementia-friendly community approach. So taking on board the recommendations that were made to date, the programme was actually evaluated by the university. So taking on those recommendations, we felt that we'd have much more of an impact if we focus within a particular, a locality within the north of the city. And we chose Cheetham and Crunsall for a number of reasons. And firstly, I suppose it's because of the cultural, the diverse culture within Cheetham. And obviously there is a lot of evidence to suggest that there is a high proportion of black and minority ethnic groups within that area, and there is that, there's much less understanding, less awareness about dementia that exists within these groups. Also worth mentioning that the north of the city has a much higher than average proportion of older people, and we estimate there to be around 350 people with a diagnosis of dementia in both Cheetham and Crunsall. So what are we trying to achieve? So we hope to enable people with dementia and their carers to remain independent, to remain part of their communities. We want to really raise that public awareness of dementia, increase understanding of skills and reduce that stigma, and of course reduce loneliness and social isolation. And we feel that communities that are more dementia friendly have more opportunities to support people with dementia, maintaining confidence and their ability to manage everyday life. And how are we trying to achieve this? So first of all, we're surveying views of people with dementia and their carers. So finding out what it is that might be preventing people from accessing services in the community. What are the barriers? And then secondly, I suppose we're taking a twofold approach. So firstly, that link with community organisations. So I've got a whole list here. So we've worked with a various number of organisations in Cheetham. The North Manchester Black Health Forum, there's Afro-Caribbean Men, South Asian Women, the mosque within Cheetham, the Irish community. And we're also making links with some of the smaller community groups, so the Somali communities, some of the African communities within Cheetham. And then secondly, there's that link between local public services. So what we're trying to do is really raise that awareness of dementia, build that capacity amongst staff so that they're better, these services are better geared to understand the needs, and so that services and organisations can be more geared up to understand the needs of people with dementia. So as Bob mentioned earlier, we've done some work where we've provided training to some of their, or in the process of providing training to some of the staff within Greater Manchester Fire and Rescue, the prevention team, and also they've linked in with the general practice that the supporting health nurse is based with. And this has been all about kind of early recognition, picking up the signs, symptoms of dementia, and really finding those hidden people with dementia. And then finally, just to mention there as well, we're also building on the previous work to increase access to health improvement and GP services. So the supporting health nurse is linked and works very closely with Cheetham Medical Centre, where she provides training and ongoing support to the GPs, active case managers, and so on. So where do we see ourselves? So we're using this as a real kind of pilot. We do hope to disseminate learning and replicate this approach in other areas of Manchester, but we are, like I said, we're at the very kind of early stages, just making those links. We'd like to continue to work to improve awareness, to reduce stigma. We're looking into further research opportunities, and then finally looking towards securing funding on a much longer term basis. That's everything. Thank you.